Isaac. It's Wednesday, which means it's time for KETK Gives Back. Today, we are honoring those working tirelessly at emergency rooms across East Texas. KETK Today anchor Isaac Ramirez joins us this morning. Isaac, who are we recognizing today?
Cynthia, today we are continuing to appreciate all of the East Texas medical workers, all of those who are working long shifts to keep our families healthy. And joining us this morning is Dr. Roman Schuyler, the medical director for Hospitality Health ER. Good morning, sir. How are you doing this morning?
Good morning. Well, thank you, Isaac.
You know, how proud are you right now during this pandemic of all your staff at Hospitality Health ER?
I'm very proud of them. They have displayed great compassion, devotion to our patients, our community. They've put their duty above their own safety, complete selflessness and bravery on their part. Very proud.
And how have things been for you guys? I know y'all are an ER, you know. How has that process been like dealing with this pandemic?
Well, it's been challenging, but we've been on top of the communication with the Department of Health, the CDC, staying on top of all of the latest information from our colleagues, both from New York, Italy, and areas where the pandemic is especially rampant, and we've been adapting all the latest information and recommendations in our emergency departments.
So we've been hearing a lot, you know, the CDC saying, hey, you know, if you think you might have it, if you are feeling the symptoms, you should really call ahead first. Have you guys been getting lots of phone calls lately?
We do get phone calls, and what we've done is we have adapted a process where we've separated our COVID-19 suspected cases, upper respiratory infection patients from our other patients, and have two separate teams to take care of both patients. And so as a result, we're reducing our chance of spreading the virus. We're keeping our facility safe. We're using PPE, personal protective equipment, putting masks on our patients, cleaning the rooms thoroughly. And in the process, we're able to take care of all emergencies. So no one should wait. Heart attacks happen. We understand that, and we're here to help safely.
And that's what I wanted to ask you, you know, as an ER, what are some of the challenges you guys have been facing here lately?
Those are the greatest challenges, is staying abreast of all the information, the constant daily news. Remember, Isaac, this is a disease that's only hit the U.S. for the last 2 months. And so we're using every bit of information that we're getting from our colleagues in the field, as well as the Department of Health, CDC, to adapt it. And so it's constant changes, constant adaptation. And that's been the challenge for us. And I think we've rose up to that challenge, and we've been able to provide good care, safe care to our patients.
And what are you guys doing to keep staff safe, you know, to make sure that your staff doesn't get any sort of disease?
So some of the things we've mentioned, we are using PPE, personal protective equipment. We're putting masks on our patients. We have two dedicated teams, one for COVID-19 possible patients, such as upper respiratory infection patients, and then a separate team for everyone else. And we're using that to keep the virus from spreading, not only to our staff, but also to our patients. Very important.
And what's the one thing you think right now that East Texans should really know about this pandemic, or, you know, things that are going on right now at Hospitality Health?
I think the most important thing is to know that stay safe on their part, adapt all the measures that have been told to us by the public health, stay home, go out for the essentials, order online, especially your local businesses. They need us right now. Wear a mask when you do go out, wash your hands frequently, don't touch your face, and we're here for you guys. We're able to treat you. We're here for any emergency, and we're happy to take care of you. We're proud to be able to do that in these tough times.
Have you guys seen any patients, any confirmed cases? Are you guys maybe doing any testing so far?
We've seen quite a few cases. We are testing all of our patients that we suspect COVID-19, and we've had quite a few patients that have come back positive. And I'll tell you something else. Our patients have been wonderful. We've been able to test also for antibodies as well, which has been a wonderful thing. We've actually been able to use our patients who've been volunteers, some of them for us, to validate the test, because the test is still fairly new, and our patients have stepped up and have done amazing things, such as volunteer to do the test for us.
And what do you mean by validate? When you say patients stepping up to validate, what does that mean?
Well, the IgG, there's an antibody test presently, and we've been validating the actual test. As I mentioned to you earlier, this illness is fairly new, and having a new test needs validation. We're using the test to work with other greater organizations to ultimately take that antibody test, use the results to later on be able to enlist those patients for donation of their antibodies to help those that are critically ill. So some of these patients that have responded and have recovered from the illness can now be donors. And our patients, a lot of our patients have come back, and they've helped validate the actual test itself, which has been an amazing outpouring on their part.
Wow, that is amazing, Dr. Schuyler. Thank you so much for doing this interview. And a big thank you to you, all your staff, everyone on the front lines working to keep our families healthy. We greatly appreciate you.
Thank you. Thank you for having me.
All righty. Thank you very much, Dr. Schuyler. Stay safe and stay healthy. Again, this is KETK Gives Back, where we honor first responders each and every week. And this is made possible by Peters Chevrolet. Peters made a $5,000 donation earlier this year that went to providing our police department new protective gear, and they plan on doing another donation soon. I'm Isaac Ramirez, and I'll see y'all next Wednesday. Back to you, Cynthia.